Imagine going to the emergency room in America. You get treated, you go home, and a few weeks later, a bill arrives. Maybe it's hundreds of dollars. Maybe it's thousands. And sometimes people can receive a huge bill even when they have health insurance. So here's the question. Why is healthcare in America so expensive? Is it the hospitals, the doctors, the insurance companies, the pharmaceutical industry, or is something much bigger happening behind the scenes? Today, we're going to follow the money. America spends more on healthcare than any other country, yet Americans can still face confusing bills, complicated insurance rules, and enormous prices for ordinary medical services. The strange part is that there isn't one single reason behind it. American healthcare is actually a massive system involving hospitals, doctors, insurance companies, pharmaceutical companies, employers, government programs, and patients. And every part of that system affects the final price. Let's break it down. Here's something most people don't realize. In American healthcare, there often isn't one simple price for a medical service. Imagine a hospital performs a procedure. The hospital may have a list price, but an insurance company may have negotiated a completely different rate, and a patient without insurance may face yet another price. So the number on a hospital's price list doesn't necessarily tell you what an insured patient will actually pay. This makes American healthcare very different from buying something at a normal store. If you walk into a supermarket, a bottle of water might have a price clearly printed on the shelf. Healthcare doesn't always work that way. The price can depend on who you are, what insurance you have, where you receive treatment, and what your plan covers. And that complexity is one of the biggest reasons healthcare bills can be so difficult to understand. Now let's talk about insurance. For many Americans, health insurance is connected to their employer. The employer may pay part of the premium while the employee pays another portion. But having insurance doesn't necessarily mean everything is free. There can be deductibles, co-payments, co-insurance, and out-of-pocket limits. So when someone says, "I have insurance," that doesn't automatically answer the question, how much will this medical treatment cost me? The answer depends on the details of the plan. And there's another important concept. The insurance company and the healthcare provider negotiate prices. For example, an insurer may negotiate a specific rate with a hospital for a particular service. That means two patients receiving essentially the same treatment can potentially have very different financial experiences, depending on their insurance coverage and network. But insurance isn't the only part of the story. Modern hospitals are incredibly expensive to operate. They need doctors, nurses, technicians, medical equipment, buildings, emergency departments, laboratories, information systems, and staff working around the clock. Some medical equipment can cost enormous amounts of money, and hospitals also have administrative departments dealing with billing, insurance claims, compliance, scheduling, and medical records. All of those costs have to be paid somehow. But here's where things get complicated. Hospitals don't all operate under the same financial conditions. Some have significant market power in their regions. And when a healthcare provider has more negotiating power, that can affect the prices it is able to negotiate with insurers. So the cost of running a hospital is only one part of the final equation. Then there's medication. Developing a new drug can take years of research, testing, and regulatory review. Companies also spend money on failed experiments. Most potential drugs never become successful products. Pharmaceutical companies argue that high revenues help fund research and development. Critics argue that drug pricing in the United States can be extremely complicated, and that Americans sometimes pay more than patients in other countries for certain medications. Now we get to one of the biggest pieces of the puzzle. America doesn't have one single healthcare system. Instead, it has a complicated mixture of private insurance and public programs. Millions of Americans receive coverage through employers. Others use government programs. Some buy insurance individually, and some people remain uninsured. Different programs can have different rules. Different insurers can have different networks, and different hospitals can negotiate different prices. This creates a system where the same medical service can have very different financial consequences for different people. And when a system becomes this complicated, administration becomes expensive too. Now we get to one of the biggest pieces of the puzzle. America doesn't have one single healthcare system. Instead, it has a complicated mixture of private insurance and public programs. Millions of Americans receive coverage through employers. Others use government programs. Some buy insurance individually, and some people remain uninsured. Different programs can have different rules. Different insurers can have different networks, and different hospitals can negotiate different prices. This creates a system where the same medical service can have very different financial consequences for different people. And when a system becomes this complicated, administration becomes expensive too. But here's the part that surprises many people. The problem isn't simply that American doctors are paid too much. And it's not simply that hospitals are greedy. And it's not simply that insurance companies are greedy. There are examples of inefficiency and high costs across multiple parts of the system. America spends enormous amounts, not only on actually providing medical care, but also on managing the system around that care. Billing, insurance administration, negotiations, claims, coding, compliance, and paperwork. The result is a healthcare system where money moves through many different organizations before the patient ever sees the final bill. If the system is so complicated, why doesn't America simply change it? Because healthcare isn't just a medical issue. It's also a massive industry. Hospitals employ millions of people. Insurance companies manage enormous amounts of money. Pharmaceutical companies develop and sell medicines. Employers use healthcare benefits to attract workers. And government programs cover huge numbers of Americans. Changing one part of the system can affect all the others. That's why healthcare reform has been one of America's most difficult policy debates. There isn't one button you can press to make everything cheaper. So why is healthcare so expensive in America? The answer isn't one company. It isn't one industry. And it isn't one simple mistake. It's a combination of high medical costs, complicated insurance structures, negotiated prices, expensive technology, administrative overhead, prescription drug economics, and the way America's healthcare market is organized. In other words, the real problem isn't just the price of healthcare. It's the complexity of the entire system behind that price. And when you understand that system, those confusing medical bills start to make a little more sense. Healthcare is only one example of how complicated American business can become. From hospitals to supermarkets to billion-dollar companies, there's usually a story behind the price you see. This is the framework. Subscribe if you want to understand how America's biggest businesses and systems really work.